The session which I was chairing is about the blood-brain barrier, and basically we had four speakers altogether that all spoke about the biology of the blood-brain barrier and how does it look like in inflammatory diseases, mainly multiple sclerosis. The blood-brain barrier is composed from a few cell types, mainly from endothelial cells. And the blood-brain barrier basically wraps the blood vessels that enter into the spinal cord and into the brain, and prevents free floating of substances and cells from the blood into the tissue. And it's a unique structure that exists basically only in the brain. It's actually the role it doesn't play is the most important thing, because normally when it's good and does its job, then it would prevent a disease, because multiple sclerosis is an inflammatory disease. The disease, you know, there's a lot of debate about exactly what is multiple sclerosis, what induces it, how does it start, and so on, but there is no debate about the fact that multiple sclerosis is a disease where immune cells invade the CNS. Now, if the blood-brain barrier would be doing its job well, it would prevent those cells from coming in. Although it's very important to know that if you would have no cells coming in, it also would be bad for you, because you do need to have immune cells to find out, for example, if a cell became a cancer cell or if there is a viral infection. So without them at all, it won't be good as well. What we know is that when the disease, there is a patient with MS, then the blood-brain barrier becomes much more permeabilized for cells to come in. Is that some kind of a protective evolutionary mechanism because the brain, let's say, thinks it's infected by a virus or by bacteria, and it needs, you know, immune cells to rush in and take care of it, and in multiple sclerosis something went wrong? It's not really clear. Now, what is very clear is that you can't completely seal it in terms of, for example, it will be impossible to seal it because the brain needs all the time, you know, stuff coming from the blood. But you also can't seal it completely to the immune system, because the damage would be that you will really have no control over cancer and infections whatsoever. So what people are trying to do is maybe to prevent at least the cells that are inducing the damage, as much as we understand them, from passing through the blood-brain barrier. The session we had today was very basic. So I'm a biologist, but we had also speakers that are medical, that have medical background. One of them also sees patients. But it was a very basic mechanistical session. So in that sense you are right, but what a lot of companies are trying to do now is actually come up with mechanisms to prevent cells from entering. So for that you need to identify what is unique about the damaging cells of the immune system and try to reach to a situation where only they will be prevented from entering into the CNS. So yes, there is, I guess, a lot of money being pushed into the direction of finding new therapies that would restore the blood-brain barrier. What needs to be done? Well, it is being done. I mean, research, more basic research, identifying better the mechanisms by which the cells come in. This has a global importance, not only for multiple sclerosis or for stroke or for anything else. It has a global importance for our understanding of the brain and the spinal cord, so the CNS in general. So better basic understanding, better understanding of the cells that enter into the CNS in the patients, and then try to target those molecules that are involved in the entry. You know, I'm always tempted to go also into therapy, but in my heart I'm a basic researcher. So I see my role, and this is what fascinates me, is to find how the immune system works and the interaction between the immune system and the cells of the CNS, in this case the endothelial cells and the astrocytes that compose the blood-brain barrier. So my role there is, I'm a geneticist, and I use genetic tools in order to manipulate the cells of the blood-brain barrier so that they would or would not interact anymore with the immune system or with compounds produced by the immune system. So just better understanding.